All right. Hey, everybody. This is Eric Shannon from Big Barker Dog Beds. And I'm here on day 4 of Canine Arthritis Awareness Week with 2 special guests. We have Dr. Hannah Capon from the Canine Arthritis Management group, and she is also the recent recipient of the Impact Award from the Royal Veterinary College. She devotes her entire life to helping dogs with arthritis. And we also have Dr. Kathy Murphy with us today, who is a veterinary surgeon and neuroscientist. We have a very interesting topic today, which is, seems like a strange question we have here on the screen. Could your home be harming your dog? And that's something that a lot of us might not ever think about, but there's a couple things that they're going to talk about today that you're going to find interesting. So before we get into it, just to recap what we're doing here, what is Arthritis Awareness Week? We feel we've been making dog beds for dogs with joint problems and mobility problems for the last 8 years. And we feel that canine arthritis is the most widespread problem, health problem facing dogs, and especially the bigger dogs that we serve. And we feel that the topic does not get as much attention as it should. So we're really, really honored to be doing Arthritis Awareness Week with all these wonderful experts. Today's day 4. We have one more day, is day 5. There's a link with this video. It's bigbarker.com/AAW. If you go to that link, we will email you all 5 presentations along with any of the resources we talk about today. So with that, I'm going to turn it over to you, Hannah.
Hey guys, it's great to be back. This is one of my absolutely beloved friends. So we will behave. We're going to be hopefully helping you look at some of the things that are in and around your home that can have a massive impact on your dog's quality of life. So should we start with our first question, Eric? Why should we consider adapting or adjusting a dog's lifestyle and where they live? What do you think about this, Kathy?
Yeah, so it's really interesting because I think often when we're considering how to manage a dog's lifestyle when it's been diagnosed with arthritis, or even just before it's been diagnosed in order to prevent arthritis, we often think of things like drug management or pharmacological interventions or regular vet visits or, that kind of thing. But there are simple things around the home that can make a huge difference, both in terms of prevention and then also in order to help improve comfort for the dog. Yeah.
Totally agree. And what I love about this is the fact that they're easily accessible by everybody. And you don't have to have a good financial backing to do them. Most of them are free of charge interventions. And that's really important to me because we care about all dogs. It's not just dogs that can come to the vets. So we're going to talk about.
Well, I was going to agree and say, interestingly, there's probably more science behind some of these free interventions that you can do than behind a lot of the supplements that are pushed towards owners, particularly a big dog, saying, your dog's got to have this in order to make sure it has good joint function. And there often, isn't as much science behind those as some of these things that you can entirely do for free.
Yeah, absolutely. So we're going to crack on something really close to both of our hearts because it's really, really obvious when you actually hear it. So one of the things that we're keen to talk about is sleep, isn't it, Kathy?
Yes. Yeah, one of my favourite subjects. So we know as human beings, we know how important sleep is for ourselves. We know that if we don't get enough sleep that we're grumpy. And we know that if we get disturbed in the night, we're often grumpy then too. And if we don't get enough sleep, so if we're getting sleep deprived, then our physical health starts to deteriorate. But this is something that I don't think we frequently enough think about for our dogs. And particularly with dogs where pain might be an issue, there's a really interesting interconnection between pain, sleep, and physical health and well-being. That's what we're really talking about, well-being. So one of the effects of painful conditions is that when the body is in pain, but particularly in chronic pain situations, the body stops producing as much melatonin, and melatonin is usually produced in the brain. It's a substance that usually is produced in the brain to promote sleep, and it's particularly important for enabling an animal or a human to get to sleep. So to go from being perfectly awake and chatting away to, okay, thanks, it's bedtime. And that process of getting to sleep is very much driven by melatonin. So if the body's producing less melatonin because there's a chronic pain condition, then it's much more difficult for the dog to actually get to sleep in the first place. And that's sometimes why you see them pacing around, circling, shuffling, they're kind of moving from one side to the other. And yes, that may actually be pain in the joints that's disturbing them, because you've got two things going on. So you've got, ouch, that doesn't feel comfortable because it hurts a bit, I'm going to lie on the other side. But also you've got the added complication that they find it much more difficult to get to sleep, and so much difficult to ignore the aches and pains in their joints because they don't have as much of this chemical produced in their brain called melatonin.
So it's a bit of a negative spiral, really, isn't it?
Yeah, and well, that's actually a really good term for it, because guess what? Disturbed sleep causes more pain. And that's because pain, I think I've heard you use this terminology before, Hannah, but pain isn't in the joint, pain is in the brain. There are two components to pain. One is the initial initiation of the pain signal, which comes from the arthritic knee or the arthritic shoulder. But you don't experience that pain until those signals have reached the brain. And in the brain, the signals are processed through a variety of different methods in order for the brain to be able to say, how painful was it? What type of pain is it? Is it pain I need to be worried about? Is it the type of pain where I need to stay off work if I'm a human? Or am I okay to go on? If I'm a dog, is it the type of pain where I need to start licking my legs, or is it the type of pain where I'm not going to bother eating because I'm too painful? All of that processing actually goes on in the brain, and sleep disturbance interferes with that pain processing, so that those pain signals are prioritized and the brain perceives them as more painful. So that's called upregulation of the signal. So the signal comes in and then it's like a dial. It just gets turned up like a volume dial, so that pain signal is much, much louder, and that's because of the disturbed sleep. Essentially, what disturbed sleep does is it stops you from being able to have control over that pain signal and how it's perceived.
And I suppose you could also say it prevents you being able to cope with your pain, and that's how I related to it. So I had a shoulder injury, and it was affecting my ability to go to sleep, and it was waking me up during my sleep. And then I was grumpy at work, and people were getting grumpy with me back. And then that was making the pain worse. So then it was harder to go to sleep. And then I woke up even more. And that went on for a long time. And I can remember halfway through it thinking, is this for life? Am I got life? And then the emotional, oh my God, what happens if this is for life? So it all interconnects really quite importantly. So trying to help them have good quality sleep is really quite important, isn't it?
Definitely. And actually for human patients, one of the drugs that they can have prescribed to them is actually sleeping tablets to try and break that cycle. Now, often that isn't appropriate for dogs for various reasons, because we can't communicate with dogs in the same way as we can with humans. So we don't necessarily know what's going on. So for us, it's much more important for our dogs to break that cycle with comfort. We need to be able to provide them with a comfortable sleeping area, and there are several things to consider with that. It has to be firm enough so that they're not floundering around trying to get out of their bed, because that's going to cause them a lot more pain. Some of these really, really soft beds are great to get into and might be great to sleep in, but they're really difficult to get out of. You've got to have a firm enough place for them to be able to tip themselves up onto their feet quite easily. And then looking for whether the dog prefers a raised bed or a bed on the floor, and making sure that bed is at the right height. So it looks like the dog is using as little effort as possible to get up and get down again. That's what you want to be looking for. So that height's going to be different for each dog, depending on, how big your dog is, for instance. Yeah. And then
I just need to add to that, because my little pet hates is when you see beds and the person very lovingly puts some cuddly toys and some blankets and a fleecy bit, and
there's no room.
This is just going to be a trip hazard, and they're going to get their feet caught up in the blankets, and you see them trying to go, oh, I don't really know where to sleep now because I'm going to lay on something. So one of the things that I do with my owners is I really, I teach them that it's okay that the bed is quite plain, and it's not billowing, and the more sequins and fluff it has does not make it a better bed. That really is something that's really important. The more fluff and patches and twinkles and name badges doesn't make it a better bed. Actually, quite often the plain, simple, predictable, reasonably firm, big enough beds are way better.
Yeah, definitely. And there is good research showing that being able to lay out flat as opposed to curling up into a smaller, rounder bed is really important for getting into some of those deep sleep phases. So, I mean, I always provide my dogs with a mixture of options. So they've got the kind of smaller, rounded bed if they decide they want to curl up like a little pussycat, but they've always got options for lying flat out so they can really get into that nice deep state of sleep.
Yeah, and it is another little tangent there, because again, this is, you've heard me say this 100 times. Also, when dogs get up from sleeping, they're quite often quite stiff for that initial period. I think all of us are like that. You get out of bed and you're like, oh, I've just got to loosen up a little bit. And if you have something like arthritis, you're going to be worse. That stiffness is going to be there for longer and possibly more severe. Do not have a slippery floor around the bed, because that's like getting out of bed onto an ice rink, and it's something that can be so easily changed. So can I tangent us into about the house, about other things that really prick your ears up, where you're thinking,
Yeah, and it's interesting because I think it's not just about, you know, the point that you made about making sure that they can get traction when they're getting up and getting down is really important to avoid slips, trips and further injury, and also micro injury, those little injuries that are created because the dog is having to try extra hard to grip the floor and make sure it doesn't fall over. But interestingly also, that type of environment tends to be associated with a high level of anxiety, because the dog knows from experience that it needs to pay attention to how it's placing its feet and where its body weight is to avoid slipping and tripping, because it will have had, you know, one or two bad experiences. So the dog learns that that floor is slippery and therefore is anxious about moving around on the floor. And anxiety, again, changes that pain perception. So as soon as the pain signals are coming in, those pain signals, the volume is being dialed up again in animals and humans that have anxiety. So that again is contributing to the pain signals and the pain pathway, meaning that that dog will be experiencing a much greater level of pain than it would have to if it had a more predictable surface to work on. So you've got two things potentially going on here. If you've got disturbed sleep for the reasons that we were talking about, and then an anxiety associated with the slippery floor or the floor where they can't get traction, so they've got that anxiety feeding in. You've got two factors there that are dialing up the pain signals. And of course, what do we do when we see our animals are struggling in pain? We go and get them more drugs to give them pain relief, which is exactly a logical thing to do. But of course, all we're really doing is feeding that vicious cycle. And what's worth doing is actually stripping everything back and saying, okay, let's make this floor as predictable as possible. Let's make sure that they can get around the house to the areas that they need to get to without having to worry about getting to it. Let's make sure they can get in and out of their bed without having to worry that they might get stuck. And let's make sure that their bed is, you know, nice and firm and allows them to stretch out, that they've got options for different sleeping areas, so they've got choice. And really, really importantly, that they've got an area that's undisturbed. And this is particularly important for those of you who've got young families, because, you know, young family households are wonderfully joyful, but they're also wonderfully noisy and they're hectic and there's a lot going on. And that's great, but you need your dog to have an option to be able to exclude itself from that. So, you know, maybe a room that everybody knows is the dog's room to sleep in, or an area that is the dog's area to sleep in. I mean, some people will put a crate up, not to shut the dog in, to take the front door off, but just to cover over and make into a little cave or a den. And then the rule for everyone in the house is you don't go into the crate. That's the dog's area. But you really do need an area where the dog knows it's not going to be touched. It knows it's not going to be talked to. It knows it's not going to be interrupted, because you don't know what stage of its sleep cycle it's in when you're interrupting it and when those things are happening. And the more you interrupt that deep level of sleep, the less melatonin the dog's going to produce, the more difficult it's going to find it to get to sleep, and then the more agitated it's going to get and more anxious. All of these things feed in.
Spiral. I think I just want to take an opportunity to quickly say two ends of the spectrum that some of our viewers are likely to see. Now, you've got the one end of the spectrum where you're going to have dogs who actually are avoiding slippery floors, and I've seen many clients whose dogs will actually hide away and stay in the corridor where the carpet is, where the rug is, and they'll stop socializing with the family in the room where the slippery floor is. That makes sense. That's really logical. But I've also seen the other extremes where the dogs do not seem to be worried about the flooring, but their behavior becomes almost a little bit manic and agitated. I want to say that to you guys is just because your dog's on that floor and they appear to be okay with it, that doesn't make it okay. Be really, really aware about slippery floors, especially dogs that have joint disease, because if you think about it, the worst thing you can do to an arthritic joint is make it go in all funny, wrong directions without warning. That's horrendous for an arthritic joint. But we're also beginning to understand and believe and gain evidence that this could actually be contributing to arthritic disease. These unexpected movements could be a source of where arthritic change is developing from. So we need to be aware about this. We're going to take literally about a 2-minute opportunity, because we can't miss this one, just to say about the third thing that really jumps out at us. How can we help owners? That third thing that me and you have a real bee in our bonnets about.
So 3 things that matter most in an arthritic dog's adapted lifestyle. So sleep, definitely, and rugs, not drugs. So making sure that they can get traction on the floor. And then the third one for me is adapted activities. So looking at the dog's, the activities that the dog likes to engage in and making sure they're suitably adapted so that we're not contributing anymore to the arthritis or any painful condition. So that would be things like looking at introducing activities like licky mats and stuffed Kongs, and activities that are quite gentle on the body but require a bit of mind work or brain work, if you like. And there are a variety of puzzle toys you can use for that as well. And then looking at the kind of energetic activities and seeing whether we can modify those. So avoiding things like repetitive, high impact activities like ball throwing with a ball slinger, and looking at whether we can modify that to something like slow, low frisbee throws, for instance, instead. So we're looking at reducing the speed that the object is moving at, making sure that with frisbees they float in the air longer than balls, so it means that the dog's not having to move quite so fast and is having to use its brain a little bit more to predict where it goes, and low to the ground, so you're not getting that explosive jumping up and then falling back down and jarring the joint. So
yeah, or hide and seek the activity as well.
Yeah, and scent work activities are amazing. Yeah, so hiding toys around the park. I mean, I go out with my dog and they're scent trained to pick up tiny little, the smell of tiny little bits of Kong rubber. So I just hide tiny bits of Kong rubber around the park and they just go around off the leaves and go looking for them. So games like that are fantastic because they're really low impact. You want to be looking to avoid the high impact stuff. And if your dog's really addicted to the high impact stuff, then just acknowledge that, but try and modify the game so that you can slowly wean it onto an activity that's less impact.
Yeah, and I think on that note, what I'll do is in the notes that are going to be on the link, we will include a Facebook Live that me and Kathy did only a few weeks ago, talking about the importance of considering these activities, because it's really common for owners to say to me, oh, but he loves the ball. I know that he's really painful later, but he loves the ball. I can't take that away from him because that's what makes him happy. I really, really beg you to watch the Facebook Live that we'll include in the link. So please do sign up to the link, because this is really game-changing stuff and it doesn't cost anything. So yes, we will see you again. But Eric, do you want to pop back? Is he going to appear?
Here I am. I'm back.
No.
Get this thing off of both of our heads. There we go. That's better.
Cool.
Okay, so we have a couple questions. But before that, I think I have my own question here. So it was really, when we're talking about beds, it's hard for me to not hop in and start talking about beds myself. I've been obsessed with dog beds since 2006. You mentioned that, and this was interesting, that disturbed sleep actually causes more pain. That's really an interesting point. Can you kind of talk about the difference between, you talked about like what makes a good dog bed, and I can talk about that as well, but what might a bad dog bed do for their sleep? Like, for example, let's say you have a bigger dog and you have one of those, orthopedic beds that come from the pet store, which is usually fairly thin. Sometimes it's egg crate foam. Is a bed like that helpful, or is it contributing to the disturbed sleep that's causing more pain?
So I will say that the only way you're going to know is to monitor what's happening with your dog. So the first thing to do is to actually become aware of what your dog's sleeping patterns are. So you want to be looking for how easily they fall asleep and how still they are when they're asleep. They don't have to be perfectly still, but you just want to get an idea. Are they moving around a lot during their sleep, which might indicate that actually, it definitely indicates that they're at a lighter level, but it might indicate that they're not getting periods of deep sleep. Are they ever getting to that stage where they're lying flat, they're twitching a little bit, or paddling after the rabbit and their eyes are blinking, because that's an indication of the deeper plane of sleep. So your first thing to do is observe. So look and see what's going on with your dog, and also observe the total amount of sleep that the dog gets. But there are two different factors here. The one is the total amount, because sleep deprivation can also dial up the volume for those pain signals. And the other one is how disturbed the sleep is. So how interrupted it is. That's either interrupted by the dog itself or by others. So I'd say that's the only way to really know, and then you can introduce a new bed and see whether that changes or not. The difficulty with the thinner beds is that actually for smaller dogs that might feel comfortable, but if you yourself lie on one of those beds, quite often it's not long before your hip starts hurting. And actually I do this because I curl up on the dog beds next to my dog sometimes. I know that's weird, but sometimes I do cuddle them there. And it is surprising how much you can spend. I think an expensive dog bed's like £100, but some of my beds are £100, and yet it doesn't take 5 minutes for my hip to start aching and for me to start shuffling around. So if you've got a big dog, then that's a real problem. Obviously, with my chihuahuas, it's not such a problem because, they haven't got the body weight for it. And then again, like the softness, you want to make sure that the bed is firm enough to actually support them and support their joints, and not too firm so that they're getting pressure sores. And again, that might be different for different shaped dogs, and will certainly be different for different weights of dog. So again, it goes back to observing them and seeing how easily they can get on it, get off it, and whether they actually get into a period of sleep that is deep enough for them to get true rest. And actually, when you watch, I've got Hannah, I think, mentioned Raven, my Belgian Shepherd, before we went live. So I've just got a new Belgian Shepherd 4 months ago from the police service. She's retired, and she had a real tough time learning how to sleep, because her job has been to wait in the kennel for whenever that she's next on duty. So she always slept with one eye open. And I do wonder if there's a bit of pain there. We don't have time to go into that. It's like diagnosing my own dog live. But I do think that I am investigating her for suspected chronic pain that I think is feeding into that disturbed sleep. But all I did was stick a camera on her, and it was really obvious, because she would have a couple of minutes of sleep, then she would change position, then a couple of minutes of sleep, then change position, or she'd be constantly groaning or shifting around in her sleep. There was just no period of time where she had undisturbed deep sleep, and it took her about a month, I would say, before I saw that settling down. One slight complication is that she chews any bed she's given. So unfortunately, I can't get her a big barker. But if she didn't do it, it would be perfect for her.
Yeah, that does make it more difficult. One thing that you can look for in beds, whether you buy a big barker or something different, because like Dr. Murphy said, it's important that the bed is firm enough, but it also has to be soft enough to be comfortable. So the only way you can really do that for a bigger dog is to have multiple layers of foam. So like in a big barker, for example, the top 2 inches is a softer foam, and that's where you get like the effect of the joint being enveloped and supported in the foam, because it'll sink into that top 2 inches. But below is a more resilient layer, and that's going to block the dog from sinking all the way to the floor, because that's the problem. I mean, the example I like to use is when I was a little kid, we would go to my grandmother's house, and it would be my parents in the bed and me and my 2 brothers sleeping in sleeping bags around the bed on the hardwood floors. And that sleeping bag is not a ton of padding whatsoever. And even though I was only 8, 9 years old, that stunk. I mean, it hurts your hip, it hurts your elbows, it hurts your shoulder. Any position you get in, it's not good. And if you have an 80-pound Labrador or God forbid a 200-pound Great Dane, and that bed doesn't have multiple layers of foam, it's really the same thing as sleeping in that sleeping bag. But I'll stop there because I could talk about dog beds all day. The last thing to say about it is if you haven't seen it yet, anybody that's watching, there was a clinical study done on big barker beds at University of Pennsylvania. And the results showed that owners reported things like the bed having a positive impact on having less joint pain, having better mobility, lots of different things. And I won't go into great detail here, but if you go to bigbarker.com/AAW in the recap email, we'll send a link to the study so you can check it out for yourself.
And I think that's really interesting, because I think the obvious go-to would be to assume that somehow that's having an effect by supporting their joints. But I would like to bet my hat that actually some of that effect is to do with just simply giving them a good night's sleep, and therefore dialing down the volume on their pain signal.
Yeah, absolutely. Because one of the things they did in the study is they put activity monitors around on the dog's collars to see how much they were moving at night. And there was some data showing that the dogs did move less at night while on the big barker bed, which does probably indicate more restful sleep.
Yeah, it makes sense. Cool. Interesting. Yeah, send me the study also, because I haven't read that, I'm afraid to say. Ashamed to say I didn't read it before I came on to meet you, Eric.
I will get it to you ASAP. So let me look through the comments here. There's a few that I wanted to bring up. We have a bunch. So first one, this is Joe Kane. Joe is actually an old friend of mine from like 20 years ago. Joe says a Siberian Husky passed away recently. He had arthritis and diabetes. I miss him every day. We were best friends. Joe, I'm really sorry to hear that. And actually, Joe's Husky, if it's the same dog, was one of the very first big barker models. Before we even sold big barker, I had some demo beds, and me and a friend of mine we rented a van, and we drove these beds around to people that were friends of mine with bigger dogs and took pictures. This is before we ever had a website. And Joe was nice enough to let us come in. And so Joe, yeah, if that's, I'm really sad to hear that. If that is the same dog, he was a nice dog. I got a chance to meet him, and I'll post a picture of him in the comments here as well. So sorry to hear that, Joe. So a couple other comments here we have. There's a lot of them, so it's going to take me a second. Oh, here's a good tip. You guys agree with this one? It says also important to
Oh yeah,
good one actually. Yeah, I like it. And nails is the other one. I mean, I'm the worst chocolate, as Hannah knows, because I've got an oldie. He's about 15 now, and he would rather die than have his nails cut.
Yeah, Dennis,
so it's like a two-man job if he cuts his nails. But yeah, you have to keep on.
Luckily, he's only about 4 kilos, which is quite helpful.
I think 2. He's only 2 kilos.
So Linda is asking, this is about back to the ball throwing. Can we roll the ball for them? Would that be
better? Yeah, that's a really good modification of the game for sure. Yeah, definitely. And actually what I've been doing with Raven, because she is a ball addict, and I don't use that word lightly, as a neuroscientist, I actually do believe that she's got an abnormal reward system associated with the ball. She's genuinely addicted to it. So I've been weaning her off really slowly, and that's one of the things I've been doing, is decreasing the speed so that eventually she can get enjoyment from a really slow moving ball. And that she is starting to get it now, so it is possible for anyone out there who thinks it's impossible, they won't possibly enjoy it. They need the, you know, the high activity, the high you know, the fast game. It just takes time. You just have to bring them down gently.
Yeah, and I think that's a really good point, is actually to say, just remind yourself who you're doing it for. Now that we've actually highlighted that it can have a lot of hazards attached to it, when you're throwing that ball, when you're using your ball chucker, stop and go, who am I doing this for? Is it because I love seeing it more than my dog actually is loving doing it? And just check yourself, because it's very important.
So Jennifer is asking, what about your dogs that sleep during the daytime? Is that bad?
No, my dogs sleep all day. They get their best sleep during the day, I think. But I only recently put cameras up in my house since I had the Belgian Shepherd, because he's an industrial shredder and I wanted to see what she was shredding. But putting cameras up in the house was the best thing I ever did. I don't know why I didn't do it before. So what I've seen is that they have better sleep during the day when I'm out, because it's predictably for a period of time and they know they're not going to get disturbed. That's better than when I'm in, even when I'm in and asleep. So the Chihuahuas, for instance, have their undisturbed sleep during the day, but during the night they're with me on the bed, and you know, if I turn over they're waking up, and they also seem to just kind of get up and move around a bit more, and somehow seem to need a pee every 2 hours. I don't know how that works, but during the day they just sleep and stay asleep. So yeah, day sleeping is good.
All right. We'll do one more question before we wrap up. This is from Nicole. She said, I don't have a big barker yet. My dogs that have arthritis are still able to get up on the couch, and that is where they sleep. How bad is that for them? Is that bad for them?
Not necessarily. It might be perfectly okay. It's entirely dependent on the individual dog. So I would suggest actually observing them to look and see how well they're coping with that. And one of the indicators can be, how long does it take them to decide to get onto the sofa? So my little oldie, who's 15, he can, in theory, jump onto the sofa, even though he's only 2 kilos. But if you watch him, what he does is he comes into the living room and then he stands in front of the sofa, kind of doing a little bit of this. And of course, I interrupt him to pick him up because I don't want him to jump on the sofa. But if your dog's doing that before they jump up, it's probably an indication that they know it's going to hurt. So they're just trying to position themselves so they get in the right place. And the other thing, of course, is to make sure they've got a non-slip surface underneath them, both when they're getting up and getting off, because that will help them with traction. But yeah, if they look like they pop up super quickly, super easily onto the sofa and pop down equally quickly and equally easily, I don't think that's necessarily bad.
And they don't walk away with a stumble, or once they're on the sofa, they get comfortable easily. Like, I think an extreme, I love my extremes today, but I've seen dogs that are quite sore and they're on a laminate floor and a leather sofa, and they're kind of doing everything at speed because they know it's going to hurt, so they just get there quickly. But that sofa is where they feel safe, so they're willing to go through that discomfort to get there. But then they slip around on the sofa, and then they slip off the sofa onto the slippery floor. You're like, no. You do need to watch. The
other thing is steps. So my Chihuahuas have steps. Bizarrely enough, Dennis doesn't want to use them. That's why I have to pick him up. Sometimes he will. But steps are really good. And even with the big dogs, just putting one step there so they don't have to do the whole thing in one go, they can do it in stages, is a good way to manage it.
So I said that was the last question, but I changed my mind.
Okay. Oh, this is a long one, Stacey.
A long one. It's covering your face. So Stacey's asking, what are your thoughts on a dog with limited mobility sleeping in a help them up harness? Sometimes our senior dog needs assistance getting up from her big barker, but I worry that sleeping in a harness would impair her ability to slip into a deeper sleep. What do you guys think about that?
Yeah, so I think that she's very lucky to have you, because you're clearly thinking about this on entirely the right lines and in exactly the same way that I would be thinking about it. And I guess it comes back to observation. So you've got to observe her and see how well she's coping sleeping in the harness. And again, looking for how many times is she changing position, how many times is she, how long is it taking her to get to sleep in the harness compared to without the harness. So you're in a great position there, because actually you could take some metrics. So you could observe her without the harness, observe her with the harness, and then compare the two and see whether they're significantly different. If they're not significantly different, then I can see that you've got a big advantage in her sleeping in the harness, because it really means that you can help her up. And that getting up and getting down is usually the most painful part. Once the dog's up on its feet, then it's, you know, it can kind of manage, but the getting up and getting down is a real struggle. So those help them up harnesses can be really good.
Yeah,
and
I agree.
Sorry, on Hannah. No,
I totally agree. And I do think that having that ability to look at the pros and cons things is so well done, that person. But yeah, in the morning, they tend to be really struggle. And if you've got something in place to give them that added a bit of stability and added bit of effort, fantastic.
Yeah, and just look for areas like, it depends on your dog's shape, but sometimes the harnesses will kind of dig in a little bit in some areas, or if they lie in a particular position, they'll kind of dent in the side, and you can just pad those out with foam or fleece. So you kind of modify the harness and make it a little bit more comfortable. You know, if they're a side sleeper, you can put fleece on the inside of the side, etc. So you might be able to modify it like that. You may not need to. You might find that the dog's actually comfortable, and you might find that over time the dog learns that harness means they're not going to have to struggle to get up, and so they're less anxious, and so they do actually end up having better sleep. That's also possible.
Great. Yeah. All right. Well, Dr. Murphy, Dr. Capon, I really want to thank you for your time. This was excellent. There's a lot of comments still here, so we will go back and answer them the best we can throughout the day and tomorrow. So yeah, go to bigbarker.com/AAW, and we can send you a recording of this entire presentation, plus the other 4 from Arthritis Awareness Week, plus all the resources we talked about, including the Big Barker clinical study. So again, thank you very much, everybody. I appreciate everybody's time, and we'll see you all tomorrow.
See you later.
Thanks, Eric. Thanks, Hannah.